Hey guys, Dr. Victoria Munoz here. So I'm getting ready to head to my office, but the first thing I'm going to do is a stem cell treatment on myself. So many of you know that I'm a low carb doctor. I have been on a ketogenic diet for about the last 5 years. Since November, which was about 10 months ago, I went completely carnivore. And even going from keto to carnivore, I noticed a huge improvement, not only in my biomarkers, but also in joint pain. Now, many of you also know that I'm a high performing athlete. I've had issues with knees, shoulders, neck, and low back. And I've actually treated all these areas with stem cell. So I'm actually solid in that respect. However, I was still having a little chondromalacia under the kneecaps. So the issue with my knees was that I had a torn meniscus in each knee. Once I treated it with stem cell, the meniscus completely healed. However, I've been having a little chondromalacia, which is inflammation under the kneecap due to tracking issues. I'm constantly working on the alignment of my knees. However, I ended up with some pain under my kneecaps. That has since gone away completely. And I was also having in my thumbs what's called de Quervain syndrome or tenosynovitis. So what that is inflammation of the flexor tendon sheath. And so what people will often notice when they have this is either clicking when they do this or the thumb will get stuck. And I was having a little bit of both in both thumbs. And so since going carnivore, that has completely gone away. However, I'm still having a little bit of pain in this joint on both sides. Now, it has significantly subsided. However, it's still about a 2 out of 10. And so as a physician, I use my hands a lot. As a musician, I notice it more when I'm playing the piano. So today, I'm going to inject these joints with stem cell. Now, the stem cell that I use is mesenchymal stem cell. Now, this is the absolute best stem cell that you can get. And the stem cell that I use comes from cord blood. So more about that later, but let's head out and I'll show you how it's done. Hey guys, so we've arrived at my office here at Precision Health and Performance, and we're going to get started with the stem cell treatment. First, I need to take it out of the cryo freezer to let it thaw, and then I need to start preparing for the procedure. So for what we're doing today, I'm only going to use one of the 0.5 ml vials. And the reason that this needs to be cryopreserved is because these are live stem cells. So I'm going to go ahead and let this thaw and start preparing for the procedure. All right, guys, so normally I would use the chlorhexidine, but I left it at my other office, so we're going to use betadine today. If I use betadine on a patient, I always make sure that they're not allergic to it, since allergies to betadine are more common. And then I'm going to continue to thaw this. Just put it in my hand, let it thaw. Just keep an eye on it. You can see that it's starting to thaw. And then I'm going to go ahead and start. Once this is thawed, I'm going to go ahead and start preparing my injection site and draw this. I'm using an 18 gauge 1-inch needle to draw the stem cell. And then after I draw it up, I'll remove the 18 gauge needle. And I will apply the 30 gauge 1/2 inch for the first injection. All right, so it's all thawed. I go ahead and just put the needle in there and draw it up. It's all in there. We're good. Now, when you prime a needle, normally you just kind of squirt some solution out. With this, we're not actually wanting to do that. We're wanting to be very careful because we don't want to lose any of the product. So we make sure the bubbles are at the top, and then just a little bit's going to come out, but we don't want too much. So there we go. Okay. We're going to go ahead and remove this 18 gauge needle now. We're going to apply the first application needle, which is this 30 gauge, which, keep in mind, the larger the number for the gauge, the smaller the needle. And because we're going in these very small joint spaces, we're going to use a very small needle. Let me show you how small this is. I can see if you can see it. It's very, very small. Okay. But because the product is pretty liquidy and not real viscous, we won't have any problem getting it to go through this needle at all. I'm just going to prime it a little bit. There we go. One little bubble, that's all we want. And now I'm going to prepare the first joint. I'm going to start with this one. I'm going to put a glove on and put some betadine on this cotton here. I'm going to clean the site really good. It's only the lateral side of the joint. The medial side is not giving me any problems at all. So normally, if I was doing this on a patient, I would have both hands and I would be able to kind of put pressure on the thumb this way to open up the joint. However, I'm going to have to be clever, and I'm going to have to use my finger this way, and then I'm going to go into the joint space. All right, so we're all cleaned up. And then I'm going to palpate the joint space. I'm going to go in. Been injecting myself for a long time, so. All right, there we go. going right into that joint space. And we're going to put half of the solution in there, which would be 0.25 mil. There we go. Voila. And then we want to move it around, make sure the solution moves around in that joint space. The only thing, I just felt pressure when I was injecting the stem cell. The stem cell doesn't hurt. The only thing that I felt was the needle going into the space, and it was just like a very mild sting. And voila, no more pain. Feels good. All right, now let's prepare. I'm going to recap this because it's my needle, and I'm going to switch out the needle for the other thumb. We don't actually touch. Oh, see, I just lost it. I'm gonna go get another one. All right. Let's try that again. Be more careful this time. Okay. So we open the needle up. We do not want to touch the hub there. Basically what we do is we just switch them out. And I'm going to prime it just to control it until we see a little bubble. There we go. I'm going to switch out my glove, obviously, because now we're going to do this thumb. And actually this thumb is a little worse. All right. The betadine essentially sterilizes the site. Everything is sterile with this procedure. Good. All right. Now we're going to take our other needle and palpate joint space. There it is, right there. All right, so we're going, and I'm actually just going to hold it like this. That one's a little more painful. Some inflammation in there for sure. And we're going to inject 0.25. Yep, I'm feeling that one a little more. Ooh, pressure. Okay. So if the patient feels pressure, then we just give it a moment and keep going. Because it's not the stem cell actually that's causing the pain. It's the pressure from the solution going into an inflamed joint. And there we go. Yeah, buddy. Okay. So I'm going to move that around. I'm going to dab that blood spot. Yeah, that one's feeling it for sure. My right hand is feeling it more than my left, but, and mind you, I didn't do any MRI or X-ray studies on these joints. I just know from experience what's going on and how to treat it. If it was an actual patient coming in the clinic, I may or may not do an imaging study depending, because some of these diagnoses are really easy to determine and treat. But there we have it. And so it typically takes about 6 weeks for the full effect of the stem cell, but because of the anti-inflammatory markers in the product, I should be pain-free within minutes. All right, guys, so there you have it. I treated both of these joints in my thumb, and I'm already not feeling pain in this one. This is the one that was more painful. This was probably a 1 out of 10. This one more like a 2 or 3 out of 10. And when I injected this one, it was a little more painful because there's obviously more inflammation in this joint. But now I'm not feeling any pain at all. And like I said, there's anti-inflammatory markers in the product. So it reduces inflammation and starts working its regenerative power right away. Typically takes about 6 weeks for the full benefit of these stem cell injections. And keep in mind that this product is extremely effective. We've got a high number of cytokines, growth factors, nanoparticles. We've got hyaluronic acid, collagen in this product. It is an allogenic product, meaning it doesn't come from our own stem cells. It comes from a donor stem cell, which is better because we take our own stem cells that are, 30, 40, 50 years old or more, and they've already regenerated so many times. Keep in mind that stem cells only have so many lifetimes and then they're done. So when you take a mesenchymal stem cell, which is a brand new cell that hasn't had any regenerative turnover yet, then you get a more powerful effect with the treatment. Hey guys, so I hope you enjoyed watching that stem cell treatment. Depending on the joint or the area of the body that we're treating, the procedure might be a little bit different, but that's basically how it's done. And just keep in mind that these human cells are mesenchymal in nature and they come from cord blood. Keep in mind that these cells are processed from bioethically donated human birth tissue from healthy, consenting mothers in the United States who have passed a comprehensive medical background check, blood screening, and had full-term live C-section births. These products are processed in accordance with standards established by the FDA and American Association of Tissue Banks to minimize potential risks of disease transmission to recipients. Infectious disease testing is performed at a certified laboratory in accordance with the Clinical Laboratory Improvement Amendments of 1988. And these products only come from a laboratory that is AATB accredited and current good manufacturing practices certified. I know there's not a lot of accessible information about stem cell treatments in the United States, but they've been legal for the last 9 or 10 years. And you do not have to go out of the country to get these treatments. You can get them right here in the US. If you're interested in learning more, you can go to our website at drvictoriamunoz.com or call our office at 480-239-1193. You can schedule your free 15-minute phone consultation to see if you qualify. And if you qualify, you can schedule an appointment to get started today. Hey guys, I'm Dr. Victoria Munoz. Till next time, take care.